I'm Jacquelyn Rosen, and I'm the speech language pathologist at Care for the Kids. Growing up, I always knew I wanted to do something medical. My dad was a pediatric hematologist oncologist, and my mom was a RN. And so I knew from the get-go I wanted to do something in medicine, something with children. And so, I grew up following my dad around the hospital on his rounds and getting to just see what he did on a daily basis. And that population was the one I knew one day I wanted to work with. And my mom was the one that introduced me to speech language pathology. And once I started learning about all the different avenues that you are in, it's not just speech and language, it's so many other things. It just grasped my attention, and here we are. A speech language pathologist, a lot of people know of us as working with speech, working with R's and kids that can't say certain speech sounds or stuttering. What a lot of people forget about is that we also work on so many other things, including language, cognitive skills, so memory, problem solving, attention, comprehension, as well as feeding and swallowing. Speech therapy and physical therapy work pretty closely, being that I know, especially for my world, being speech therapy, when we work with kids that are working on feeding and swallowing, a lot of it is focused around their posture, how they're sitting, how they're positioned to better enable them to be able to swallow safely. And with kids that are going through cancer treatments, a lot of that has to do with brain tumors, chemotherapy, radiation therapy, and a lot of these kids end up with cognitive deficits. So anything with the brain, so that could be that they're having issues now with focusing in school, they're having a hard time remembering things, they're having a hard time getting words out, as well as their feeding and swallowing, where a lot of these kids end up nauseated, they don't feel good. Sometimes when they eat, then they don't feel good. And that can lead to bad experiences associated with feeding. So part of my job is turning that around and bringing their experiences to positive experiences, to where instead of food being around these negative, not feeling well, to bring it into a positive light. In speech and language, a lot of that is through repetitions, through doing like speech sound repetitions, doing different exercises that are surrounded around reading stories, reading words, getting them to be able to do something just in its own simple form, and then gradually bringing it to a conversational level where they're using it in their speech when they're just conversating with others. And then for swallowing and feeding, a lot of it could be if they end up with weakness, let's say, just as physical therapy works on, using weights or exercises to strengthen your arms and your legs, we do exercises that strengthen the muscles of your face and your throat to better help all your food and liquids go down the right pipe. A lot of people don't think of swallowing as anything that comes naturally to us. We don't remember learning how to swallow because we were newborns. We were little. We never had to learn it until we lose it. And so our needing to work on it comes from multiple different things. So whether that is muscle weakness, our muscles not coordinating and working together appropriately in the right sequence, and even something as being intubated in the hospital on a ventilator. All these things and more equate to difficulties with things going down the right pipe. So leading to, beginning with even our ability to just chew foods. So getting it in our mouths, having it not spill out, having the ability to chew it up, not have it get stuck in our cheeks, and then moving it backwards into our throat where we initiate a swallow And when that happens, it should go down the right way into our stomachs. But with a lot of children and adults who have a swallow impairment, it goes down the wrong pipe. So it's going down into their airway. A lot of us, when that happens, it happens to any of us, where we take a sip of water and it goes down wrong. And what do? We cough and cough and cough and cough. And so with some people, they may not have that reflex or that sensation and that protective strategy of coughing, and it will just go right into your airway and into your lungs. And that is something that we need to work on, because we don't want people ending up on permanent PEG tubes and feeding tubes if they don't need to be. Especially in pediatric oncology population, with families and the patients themselves, there's also and always bad days, and I think that the main thing to remember is just being there for them, being a support system, someone that they can talk to. Yes, my therapy strategies, we try to be as structured as we can. It usually doesn't work out as we plan, but we try. And some days you have to be a listening ear, and that for most could be more therapeutic than anything. My favorite part of my job. Well, going into this field, I wanted to be that person that gets to work with kids, that's not someone that has any negative thought, not someone that's coming at them to poke them, not someone that they have a bad thought of entering the room. I wanted to be that person that's fun, someone that they know, okay, I'm gonna have fun and a good time with this person. And my ultimate favorite part of that is I get to teach kids how to swallow, how to eat, how to talk and speak and use language in social environments in the form of play. And to me, seeing kids advance and get better through that is super gratifying. If there was something that a lot of people wouldn't guess or think, was I was definitely a video game nerd growing up. I beat all the Sonics and Marios, and so it's fun being able to talk to children and teenagers now about what games that they enjoy and how they're different from the ones that I played, or some of them have played the same ones, but it definitely catches people off guard when I tell them I was a little bit of a video game nerd growing up.